So it's actually one of the reasons why I went back to school. But I also find bacteria super fascinating. Does anybody else here find just bacteria in general really fascinating? Okay, so let's talk after this. But anyways, that was really the main drivers of why I chose this topic. But I also was asking myself, well, what are some ways that generally affect somebody's overall health? And I came up with two main ones. One being diet and one being exercise. But after doing a lot of research, I think that needs to be expanded to this three-component approach, being diet, exercise, and bacterial content. So I'll get more into the bacterial content part as we move along, but just to kind of provide where I'm gonna go with this. Second, this is a super hot topic right now, so again, just wanted to touch on some of the research that's out there. And that brings me to my third point of a lot of confused consumers are out there, especially regarding probiotic supplementation. Is anybody in here still a little confused about probiotics in general? Kind of? Yes? Okay. So hopefully I'll answer some of your questions related to that too. So what is the gut microbiome? It's the complex community of microbes and their genetic material. So there's about 100 trillion in your GI tract alone. Majority of that is in the colon. So I think that number is just mind-blowing. But to put that into perspective, that's about 2 to 6 pounds of bacteria based on a 200-pound person. And development begins at birth. Typically when you're first exposed is through the vaginal birth canal. But if you were born via cesarean, your gut microbiome may have developed a little bit differently. So I think that's really interesting. But overall, the gut microbiome does continue to develop as you grow. And then microbes are known to benefit health or promote disease. So when you hear the terms good and bad bacteria, that's really what that's referring to. But just to provide a couple of examples of good bacteria, those are things like bifidobacterium and lactobacillus. And two strains that are known as bad bacteria are staphylococcus and clostridium. So here is a picture of essentially the gut-brain axis. So the gut-brain axis is a bidirectional communication between what you see on the top, which is your brain, and at the bottom, your gut microbiome. So this is really essentially showing how the gut microbiome is communicating through different processes in your body. So to break this into a little bit more of an organized approach, first you'll see the vagus nerve. So the vagus nerve is kind of like your highway of communication between the brain and the gut. The vagus nerve is a part of your parasympathetic nervous system, meaning your rest and digest. So moving on from the vagus nerve, we have cortisol. Now cortisol is opposite of that rest and digest system, and this can directly impact your digestive functionality, your bacterial abundance and diversity, and even your immune cells and their function. Third is the epithelium. So I just wanted to point out how the epithelium is that single cell layer of the small and large intestines that is essentially there to keep the bacteria in your gut instead of leaking into your bloodstream when it shouldn't be. And then how many people know the particular neurotransmitter that's mostly produced in your gut? Or does anybody want to share what that one is? Okay, I'll tell you. Oh, yeah.
Serotonin.
Serotonin, yes. So serotonin is your feel-good or your happy chemical, and this is actually mostly produced in your gut, like I said. So a lot of us, or I should say a lot of people, have thought that all of our neurotransmitters are mostly produced in the brain, but that's not actually the case. So if somebody's low in serotonin, they are going to be low or have a negative impact on their mood, their cognition, and their emotion. So So then to get a little bit more complicated, tryptophan is actually the precursor to serotonin. So if somebody's low in tryptophan in their diet, because we are not making tryptophan ourselves, they're going to then have a low amount of serotonin. And again, that could negatively affect mood and emotion. And then lastly, short-chain fatty acids. Those are a product that the gut bacteria produce from dietary fiber. So this short-chain fatty acids, they can provide also a positive effect on your mood as well. So what are some ways that we can manipulate our gut bacteria? So I have listed for you quite a few ways, but for the purpose of this presentation, I'm really zooming in on probiotics specifically and how they affect mental health, constipation, and colon cancer. So diving into my first research study, this is on the effects of probiotics on mental health and the hypothalamic pituitary adrenal axis. So the hypothalamic pituitary adrenal axis, that is essentially where that cortisol is getting produced. So if you see the HPA axis, that just think of the stress response. And this study was published in 2016 and it was conducted in Iran. So the researchers' main question was, are probiotics effective in improving mental health and the HPA axis in petrochemical workers? The intervention included 20 subjects and they were divided into two groups, one being a probiotic group and another being a placebo group for 6 weeks. To be included in the study, you had to be a petrochemical worker and you had to be between 20 and 60 years old. And then just to name a few of their exclusions, you could not have any type of antibiotic usage recent to the study, and you also could not be taking any nutritional supplements, including probiotics, in addition to their experiment. So table 3, this is showing the effect of the daily consumption of probiotic yogurt and a probiotic supplement on the mental health status and HPA axis biomarkers. So what I have highlighted for you is 2 questionnaires that the subjects were looking at and assessing their mental health. So the first one being the GHQ, that's their general health questionnaire, and the second one being the DAS score, or their depression, anxiety, symptom scale score. So what they found with both probiotic yogurt and probiotic supplementation was that their mental health was improving based on those 2 groups. Their secondary outcomes were the items on here that I do not have highlighted. So those were the secondary outcomes, like I said, that were addressing the HPA axis biomarkers. So they did not find a significance with those. So I just wanted to point that out, but that's why I didn't highlight that. So some of the interesting things I found doing the EAL worksheet, some strengths included there was a 2-week washout period, so trying to get their participants at baseline I thought was a strength. Also, the ratio of males versus females was important to have. It was equal. But what I really liked was that they had dietary restrictions as well as controlling for energy intake and physical activity. So a lot of research I find is not really focusing on these things, but I think they're so important when you are addressing these type of outcomes. And some limitations, just to name a few, it was a smaller sample size. It was particular to a certain ethnic group, and they used subjective questionnaires as their primary outcome. So again, to conclude this particular study, the probiotics did improve the mental health in those petrochemical workers, but those HPA axis biomarkers did not show a significant improvement. And I rated this study a positive rating, again, because they did account for diet, exercise, and even the cortisol awakening response, which can play a role in that cortisol process in the gut-brain axis. So moving on to my second study, this one is based on probiotics and their effects with constipation. So this study was published in 2018 and it was done in South Korea. The researchers' main question was, are probiotics effective in improving clinical symptoms, changing fecal microbiota, and regulating serum immune cytokine levels with patients who have IBS-C or FC. So the differences between the two, IBS-C, you are presenting with clinical symptoms like abdominal discomfort, gas, bloating, things like that. Where FC, that's known as functional constipation, that you are not presenting with any of those clinical symptoms. So those two, IBS-C and FC, they were looking at those particular patients, and they used 171 subjects who were divided into two groups, probiotic versus placebo, for 4 weeks. And then they actually followed these participants for an additional 4 weeks after probiotic supplementation to see if there would be any type of effect after intervention. To be included in the study, you had to be between 18 and 75 years old, and you also had to be diagnosed with IBS-C or FC. And just to list a couple of the exclusion criteria, you could not have any type of prescribed GI medication. You also couldn't take any additional dietary supplements like a probiotic, and you could not have progressive malignancy or heart failure. So this graph is showing their primary outcome that they were looking at, which was their stool consistency. So they measured this by the Bristol Stool Form Scale, and what they're looking at here, what this is showing, is at week 4, they found significant improvement in the stool consistency in the probiotic group. But what's even more interesting is, remember, weeks 5 through 8, there was no probiotic supplementation, but this is showing that they continue to improve in their stool consistency, meaning that the probiotics were most likely colonizing in the gut. And then this bar graph is showing the total bacteria analysis, or their fecal microbiota analysis. So the first one on your far left, this one's looking at the lactobacillus species. And at week 4, the probiotic group did significantly show a higher abundance of this strain. But then at week 8, it dropped. So now on the far right-hand side, we're looking at a particular strain called L. plantarum. So L. plantarum, they were looking at week 4, it did show an increased abundance. But then interestingly, at week 8, do you see how that bar graph, that really dark bar graph, is quite a bit higher than the one on the left? So I think that's really interesting that even though that particular strain did not show a significant improvement, or I'm sorry, a significant difference, it's still important to note that that strain in particular did show an increase. And actually, in another randomized human study, this particular strain, I noticed, also helped improve the fecal concentration of those short-chain fatty acids. So some of my findings on this study, the strengths included the participants did have 100% compliance. They also had their baseline measurements, and they had more than one test method that they were looking at. So again, being the clinical symptoms, the serum immune cytokine function, and the overall bacteria content. And some limitations did include, it was a single center study, it was a very short intervention period, and their fecal microbiota was not identified by complete sequencing. So one of the main reasons for that is because there's quite a bit more significant increase in cost with complete sequencing. So in their discussion, they noted that that's why they weren't able to do that. So to conclude this study, probiotics did show to significantly improve stool consistency, but again, really interesting that the beneficial effect that they found with L. plantarum remained after they stopped the probiotic supplementation. Again, the areas that they did not find improvement were those clinical symptoms as well as any type of inflammatory markers that they were measuring. So I give this study a neutral rating, especially because they did not include any type of dietary, exercise, or even hydration factor, which I think plays a huge role when you're looking at constipation. And then my third study. So this one is particularly looking at probiotics and colon cancer. So this study was published in 2017, so very recent, and it was done in Sweden. The researchers' overall question was, can probiotic intervention modify the microbiota composition of patients with colon cancer? So their intervention included 21 control subjects to get a baseline amount of data, and then they had 15 colon cancer subjects, again, dividing them into probiotic versus placebo group. And in this study, they used quite a few different methods to look at their bacterial content. So they looked at their fecal microbiota, their mucosal microbiota, as well as, what was the third one? Tumor microbiota. To be included with this study, you had to have stage 1 through 3 colon cancer, and you had to have the presence of at least one malignant tumor in the colon. You also had to be 18 years or older, and then you weren't allowed to participate if you had an adenoma, which is a benign tumor, and you could not also have any type of recent antibiotic usage or probiotic usage. So table 2, this is showing the microbiota alterations in colon cancer mucosa and tumor samples. So what I have highlighted for you in red are specific strains that were actually higher in colon cancer patients compared to their healthy control. And then what I have highlighted for you in green was actually shown to be significantly depleted in colon cancer patients compared to the controls, which I find super fascinating. And the researchers were noting that these particular strains, there's 2 in particular, that actually have become biomarkers to colon cancer. And table 3, this one is showing the alterations with probiotic intervention. So the 2 in particular, Fusobacterium and Peptostreptococcus, those 2 were actually decreased when they had probiotic intervention. So these would be known as some of your bad bacteria, but like I said, these 2 strains are biomarkers to colon cancer. So the fact that they were able to reduce them with a probiotic intervention is really awesome. Some strengths from the study: biopsies were taken from the mucosa, which typically is more accurate, but they also had fecal samples taken at baseline and after they had their colonoscopy, and they also had that control group to compare to. But some limitations, they did have a really small sample size, but I still found this study to be really valid because colon cancer is so specific. And the fecal sample timing, it was not controlled post-colonoscopy, so that could really vary their results. And lastly, the intervention length varied significantly. So they had patients between 8 days of an intervention all the way up to 80 days. And mostly this was due to ethical reasons. So to conclude my third study, patients with colon cancer actually showed that they have a different microbiome than the healthy control population. And the colorectal cancer associated gene or genera was the Fusobacterium and the Peptostreptococcus, which were actually reduced in the fecal microbiota of patients who receive probiotics. So I gave this study a neutral rating, mostly because the intervention significantly varied, but also because, again, they did not look at their diet, exercise, things like that that could alter the bacterial results. So what do we do with this information? I feel like as RDs, we do need to stay current in this topic of gut bacteria, and especially because research is continuously changing. But I also wanted to point out that supplements are in our scope of practice, and probiotic supplementation is a really big buzzword right now with a lot of patients that we may encounter. So I think it's really important that we have a lot of the credible data to share with them. And that brings me to my second point. We encounter patients with mental health disorders, constipation, and colon cancer for some of us on a daily basis. And ultimately, we are the food experts. So I think in my opinion, we should be providing patients with probiotic-rich foods first, like yogurt, kefir, sauerkraut, you've probably heard all of those things, but also ways to incorporate those foods into a patient's diet, because they may not know what to do with them. But as far as probiotic supplementation goes, I think there still needs to be more research on the long-term use of probiotics, just especially because they can vary so much on the market. So I just wanted to leave you with these three questions. Could probiotics become a new class of antidepressants? Or perhaps a new treatment for constipation relief? Or maybe even colon cancer intervention as a part of their treatment regimen? So I think in my professional opinion and what I found in the research, there are strains that have been shown to provide positive effects on a lot of these areas of health, and new health therapies may be emerging that include bacteria as the main or the primary intervention. So I think it's important that we stay on top of the research so we can really best help our patients' overall health. And those are my references, so thank you for coming. And if anybody has any questions, I'd be happy to try and answer them. No questions? Awesome. Well, this will be posted on our website, so you can always go back and look at the slides, or feel free to reach out. But that